Today, we're going to be talking about the best ways to reverse your diabetes. Now, before we go into the steps of how to reverse your diabetes, I do want to make sure we identify the difference between managing diabetes and actually reversing diabetes. You see, managing diabetes focuses on the symptoms of diabetes. And what are the symptoms? Not the symptoms you're thinking of. The symptom of diabetes is elevated sugar, right? You see, sugar is being elevated is not the cause of your diabetes. And I know I'm about to blow some of your minds right now, but the reality is most of the stuff you're currently doing or being told to lower your sugars is not fixing your diabetes. It's not reversing your diabetes. It's just making things look better on paper. It's referred to as managing diabetes. If you truly want to reverse your diabetes, you have to first understand what is causing your diabetes. Now, specifically, I have a diagram right here to show you guys specifically what is going on in the body. Now, from a normal perspective, normal physiological perspective, we need to consume food, and that food is then absorbed and digested in our gut and then released into our body as glucose. You can see here as glucose. That is our fuel source. It's how our body functions. If we don't have enough glucose, we can't function. Now, the purpose of glucose is to get that glucose into our cells, just like the purpose of your car is to take the gas from the gas tank into your engine. What happens if you don't get any gas into your engine? You're not going anywhere. Same thing happens in your body, but we're talking about at a cellular level. You see, every single tissue and system in our body is made of cells. This is why diabetes is so scary and so dangerous, because it can impact any area of your body and cause complications anywhere. Think about it. There's not really many other conditions, if any, maybe except for metastatic cancer, that can really impact all tissues of your body like diabetes can. So if we look at the drawing here, what has to happen is you have to be able to get this sugar into your cell. And the way that occurs is your insulin is then brought down here with your sugar to your cell, and then it attaches to this receptor. Now, obviously, I'm doing this in an easier version for you to understand. For those of you who are more tech savvy and you understand more about biochemistry and everything, this may seem very simplistic, but many individuals don't have that ability. So your insulin has to attach to this receptor, and then what occurs is a door essentially opens in your cells, which allows the sugar to enter your cell. That is like getting the gas from your gas tank into your engine, because inside your cells are your engine, and this is how your body functions optimally. If you have good regulation of sugar, your body is going to function well. You're going to have reduction of reduced for diseases and other problems that'll happen as things get worse inside your body when you don't have normal blood sugar regulation. But what happens as a type 2 diabetic is something occurs in this specific area that blocks the ability for you to get your insulin to the receptor as well as getting the sugars into your cells. Now, again, if you can't get the sugars into your cells, if they can't get in, where are they going to go? They're going to go back into your bloodstream, causing elevated sugars. And when you have elevated sugars for a consistent period of time, what happens? You get a diagnosis of type 2 diabetes. And that's how the problem happens. And this process can take multiple years, 10, 20 plus years, before enough cells are damaged that you're doing this inside your body. That's why many times for most individuals with diabetes, they get diagnosed on a routine office visit. Maybe they go to the hospital for some reason, or they go to their doctor for a yearly checkup, or etc., and they do an evaluation. They say, you have elevated sugars, you have type 2 diabetes, even though they don't have symptoms of this. Now, as this progresses, the symptoms can start to develop over time. And what happens when you have this diagnosis? What's the recommendation? Eat better, exercise, weight loss, medication. And the purpose of all of these are what? The purpose is to try to help you decrease blood sugars. But again, let's focus on this here. If all the focus is to lower sugars, is that ever going to fix your cells? No. Now, could some of these things, nutrition issues, exercise, weight loss, could some of those things be the mechanism that is driving this problem right here? Sure. But what we have found in working with thousands of individuals over the years is that there are usually way more problems than just these. These could be 3 of the problems that are going on. But on average, we typically see in our office, on average, we see between 10 to 17 problems that is causing that problem there, that is causing the cells in the inability for it to lose or the ability to get sugar inside the cells. So again, if we're only focusing on these, which is to help you lower your sugars, it will not fix here because there's usually much more problems that are going on that are contributing to the cellular damage. So now that you have that understanding of what's going on here, what are the best ways to reverse your diabetes? So let's go over some of these things. Number one of the best ways is to find the cause, right? To find what is this going on? What's happening right here? What's the specific problems that are going on in this area that is causing your ability to have high sugars? Not what's the next best food? What's the next best supplement? What's the next best exercise? Can those things be beneficial? Yes, if your goal is to lower sugars, follow those things. And I have videos in my YouTube channel if you want to learn more about that. But if your goal is to actually reverse this, because think about this. What happens if we start identifying the problems you have and we start removing those problems? What's going to happen here? This is going to go away. And the ability for sugars to get into your body or your cells is going to be much more functional. And so if more sugars are going into your cells, what's going to happen to your bloodstream? Normal blood sugars. You see, this is exactly what your body's able to do. We just have to identify what problems or mechanisms that have been going on in your system for 10, 20, 30 plus years that have been causing this damage. And we can do that. So we have to find the cause. And how do we find the cause? We have to identify it by doing testing, comprehensive testing, not just the basic testing that you're currently doing with your doctors, because that's going to only identify what your sugars are actually doing and where are they currently right now, which is fine. Or if a need for more medication, again, that's fine if you're just looking to manage your diabetes, but not identifying specifically how to reverse diabetes. So is it possible to truly reverse diabetes? 100%. We see this in our office all the time. We rarely see a patient fail because we're able to identify their problem. And so once we find the cause by doing proper testing, then we have to customize a plan of action that's going to address the cause. How many problems do you have? Do you have 10 problems? Do you have 15 problems? Do you have 30 problems? This is where the customization comes into play. And the great news is that the customized solutions is not more medications. You see, there's no medications currently being utilized right now that is shown and identified to reverse diabetes. Not one. None. They are all have been identified to lower sugars. They do a great job in that in many cases, but not one has ever been identified to actually stop the progression or reverse diabetes. So everything that we do is more natural and holistic. So I always say, people always ask me, what are the negative effects of what you do? The negative effect, I guess you could say, is better health, if that's even a negative, because that's what happens with our patients. Because once you start addressing these problems and improving the function of the body, what's going to happen to you? You're going to feel better. You're going to function better. You're going to see improvement all the way around in every aspect of your life. Your friends are going to notice it. Your family's going to notice it. And more importantly, you're going to notice it. So what I want you to really focus on here is the key components to reversing diabetes is number one, find the cause. Number two, identify the cause. I guess those kind of go together by proper testing, comprehensive testing, not just your basic testing. If you think that I'm going to be able to evaluate your situation by you handing me the test that your doctors run on you, never going to happen. I can tell you if you're taking the right medications or if you should probably go back and maybe have some other recommendations of how you should be eating, but it's not going to fix your diabetes. Once we have that data, this allows us to create a customized solution, because unless the solution is customized to your needs, you're not going to get the results. So hopefully this is starting to give you a better idea of what needs to be done to specifically help you reverse your diabetes. Number one, you have to identify what's happening to create that solution for yourself. If you're looking for more of a solution to diabetes rather than management, make sure you continue watching our show here, because we're going to be going into much more detailed information of the specifics that we can do, the type of testing that we do. A lot of data needs to come out so you have the proper steps involved for your needs to reverse your diabetes. If you're not ready for that, that's okay, but eventually you will be. So make sure you follow our page, because you're going to want to continue to stay here. All right, you guys, it was great seeing you today. Hopefully this helped you out, and we'll see you on the next show. Take care.